Halifax doctor is not only changing the life of patients, but he's also changing the way people look at surgery. Dr. Ivan Wong, University and an orthopedic surgeon at the QE2 Health Sciences Center, is literally bringing people into his surgeries by live streaming them on social media. It's a new step that doctors and professors are using to showcase and teach their skills. So joining me this morning to tell us more about it is Dr. Ivan Wong. Good morning.
Good morning.
Thanks so much for being here.
Thanks for having me.
So this is a really cool kind of progressive initiative, it seems like, to be able to offer something like this as a teaching tool. I guess where did the idea for it come from in live streaming surgeries?
Well, we actually just finished a conference in Shanghai, and while there, we're teaching novel surgeries that we're doing here in Canada that currently aren't available in China. So being able to do a live conference, we're able to teach several hundred surgeons at a time. Wow. And then they were so interested that they wanted to teach a much larger audience from many different cities in China. So they wanted to do this live streaming surgery from multiple countries around the world.
And I guess kind of just segueing with that, I guess, is what's the benefit of offering a live stream for students who are kind of, I guess, sharing techniques across the world, as you'd mentioned?
Absolutely. Well, one of the things you just finished seeing is video from surgery. So we do a lot of video teaching right now because video is a lot more interesting or a lot more informative than just still pictures.
Right.
So the next level after that is live surgery, where you can see every little aspect of the surgery and be able to ask questions as it's going.
Is this something, too, that you've heard from students that they kind of want that more interactive way of learning? Like you said, rather than just looking at a photo and kind of gauging how you would do that technique, you actually get to see it firsthand.
Absolutely. So everyone wants to be able to be interactive, be able to ask questions when they are, be able to see troubles when they happen so that you know how to get out of them and how to overcome them and make things easier for themselves. Being able to see things as they are in a perfect condition is one thing. Being able to see things and make them into a perfect condition is another.
I would think, too, for doctors alike, it would also be a great tool to kind of share tips. You know, maybe somebody has a different technique or something that you could kind of get around it a little bit quicker maybe than what you were originally taught. Do you think this is kind of an innovative way to bring, I guess, all doctors together?
Yeah, so that's what we find is from every conference and every discussion that we have, more and more people join in the conversation. And by being able to see other people do things, the whole field advances at a much faster pace.
So I know, too, that your specialty is mainly hip, knee, and shoulder. So is this all stuff that you're going to be live streaming in the coming year?
So this is actually one of our first streams that we're going to be doing with our Chinese counterpart. We're only going to focus on the shoulder and for a new technique and technology that they currently don't have. So very few surgeons around the world actually do this type of a surgery at the moment. So we're hoping to be able to teach this and then augment this to use other joints and other techniques as well.
So I guess would you be taking live questions while you're doing this?
Yeah, so this is a bilateral feed, which means that we'll be sending out two streams of video, one from inside a joint because we do arthroscopic surgery, one from outside the joint so they see how the hands move and you can kind of have an example of some of the video that we showed there. They'll also have a stream of video coming in from their conference center, so we'll be able to take live questions while we're doing the surgery. Do
you find that this could also be a way to, I guess, maybe ease some patients also if they can kind of see how the procedure is actually done? Or do you think that maybe it would scare them a little bit kind of watching it in the flesh, I suppose? So this is actually a conference just for surgeons and surgical trainees. So no patients are invited to this type of a conference yet. I'm sure that in the future, and there have been examples of this, but most of this is focused on people wanting to learn how to do this surgery. So when you conduct surgeries here, do you ever offer a copy of the surgery that you've done to your patients? Yes, essentially almost every patient coming through is given the opportunity to have a copy of their surgery so they can understand the intricacies and the difficulties that we encounter doing the surgery and the requirements that they're going to have to do the rehabilitation afterwards. Interesting, that's pretty cool. Yeah. That's a great idea. And so when can we expect to see this first live stream, did you say? Oh, so this again is for all the surgeons that are invited into the conference. We will be live streaming this on August 30th and hopefully have a good first take. All right, so any plans to go forward after that, or you're just going to see how the first one goes?
Well, we'll see how this first one goes.
Okay, sounds good. So we'll definitely keep in touch, and then we'll give you another update as well. But it seems like a very great initiative and kind of up and coming, I guess, with technology and things like that.
Yes.
Thank you so much.
Thank you.
If you're looking for more information on Dr. Ivan Wong, of course, you can head online to website, Twitter, LinkedIn, all the information you need.